Hi, this is Professor Diaz, and today we're going to go over the common discomforts of pregnancy, which is your ATI Chapter 4. So let's begin with talking about the common discomforts in the first trimester of pregnancy. So first, I want to talk about nausea and vomiting. This is very common in pregnancy. Women experience morning sickness. Usually it's due to the elevation in hormones, due to pregnancy. There's usually a decrease in gastric motility. There usually does not last beyond 16 weeks. So usually it subsides around those first trimester. If it persists, it may lead to hyperemesis gravidum, which is more of a severe case of nausea, vomiting that continue on past that first trimester. And when we talk about antenatal complications, we'll kind of get into more of the seriousness of hyperemesis gravidum and what it can cause during pregnancy. So the interventions that you're going to be teaching your patient, because one of the things when you're teaching prenatally or just throughout pregnancy is that you're going to realize you're doing a lot of teaching. And so with this, when they're having morning sickness, you want to talk about to your patient about eating dry crackers or toast half hour to an hour before rising in the morning. Try to avoid an empty stomach because that can also increase nausea. You want to encourage them to eat small protein meals frequently throughout the day. It kind of holds them a little longer. Drink fluids between meals. Avoid any greasy, odorous, spicy, or gas-forming foods because that can also increase nausea, vomiting. It's led to believe that increased vitamin B6 can also help decrease that nausea, vomiting. Anything with ginger flavor like vitamins or candy can also help with morning sickness. Some may need to be prescribed anti-nausea medication, which is an antiemetic medication, so that it can also help relieve those symptoms. So let's begin with talking about breast tenderness. So this is an increased vascular supply of hypertrophy of breast tissue caused by estrogen and progesterone, which are thought to contribute to tingling and heavy sensation of the breasts. So we want to encourage our women to wear a well-fitted support bra, or they can purchase a nursing bra, which is stretchable, it's lightweight, and it's not constricting, and it helps allow for room for when as their breast is growing. They also want to avoid harsh soap on nipples to prevent drying. So let's talk about urinary urgency and frequency. So this is very common in the first trimester and the third trimester. So in the beginning first trimester, as the hormones are developing, it's causing increased blood volume and glomerular filtration rate. So this, so the women will experience having to go to the bathroom and having that urgency and frequency. So towards the end of pregnancy, as the woman is gaining weight due to the pregnancy, they can gain anywhere from 25 to 35 pounds or more, but ideally you want to stay within the 25 to 35 pound range. So that pressure of the uterus literally sits right on top of the bladder. So that 25 to 35 pound weight or more literally just kind of keeps putting pressure on the bladder and causing this woman to have to go more frequently to the restroom. With that, it also causes the women to have that like stress incontinence where they just can kind of pee on themselves a little bit, just what sometimes it can be caused just because of the pressure. It can be caused due to laughing or sneezing. So again, one of the reasons that also causes it is because the progesterone relaxes the smooth muscle of the bladder. So the ways that we can help to alleviate these symptoms is empty the bladder frequently, decrease fluid intake before bedtime. They might want to wear a perineal pad just in case if they have any leakage, so they don't have any accidents. We want to limit caffeine because we know that's a diuretic, so it makes them increase them to go to the restroom a lot more faster. And then perform Kegel exercise. Those help straighten the vaginal wall. All right, so we have our urinary tract infection. So, that is common during pregnancy due to renal changes and vaginal flora becomes more alkaline since we know that the vagina is a little bit more acidic. So always wipe the perineum area from front to back after voiding. Avoid bubble baths. To encourage the woman to wear cotton underwears because sometimes if they wear the lycra, it promotes a lot more moisture, which increases the risk for infection. Avoid tight-fitting pants. Consume to 8 glasses of water per day. Urinate before and after intercourse to flush bacteria from the urethra that are present or introduced during intercourse. Fatigue is also very common in early pregnancy and then just towards the end. There's a lot of hormonal changes in the early pregnancy and periodic hypoglycemia as glucose is used by the embryo for rapid growth. It's more prominent in early months of pregnancy. So again, plan for daily naps during the day. Encourage the patient to try to get 18 to 10 hours of sleep. Take frequent rest breaks during the day and go to bed early can also help. All right, so we're going to now move on to the common discomforts of pregnancy in the second and third trimester. So some women may experience heartburn. Usually that's because the stomach gets displaced by the enlarging uterus. So kind of got a little squished all around to accommodate that growing uterus. The slowing of the GI tract motility and digestion can also occur due to the progestin levels. There may be some experience of regurgitation or backflow of the gastric contents in the esophagus, causing burning sensation behind the sternum. They may have this burping or a sour taste in their mouth as a result of it. So again, we want to encourage them to eat small, frequent meals. Try not to allow the stomach to become empty or full, because then that can increase that heartburn. They want to sit up 30 minutes after eating a meal. So if they want to avoid lying down because again that can have that backflow of gastric content which can cause that heartburn. Avoid gas forming and greasy foods, and sometimes if it's really severe that some people just suffer through it, then they should recommend a taken over-counter antacid. So they just want to make sure that they ask the provider permission to make sure that's okay and safe for the baby. Okay, let's talk about constipation and flatulence. So again, occurs around the second and third trimester. There's an increased level of progesterone causing bowel to be sluggish when increased water absorption, so it results in hardening of the stools. So again, they have pressure on the enlarging uterus on the intestine. And so depending on how their diet is, if they're not eating fruits and vegetables or a high fiber diet or fluids, that can increase the risk of constipation. Just ambulating, exercising moderately can also, if they're not doing that, that can increase the risk of constipation. So you want to make sure if they're on any iron supplements, that can also increase the risk of hardening stools. So again, we have to assess all those things prior to really understand what's the underlying cause. So again, interventions will be drink plenty of fluids, eat diet high in fiber, have adequate exercise to stimulate peristalsis, and use stool softener if prescribed by the healthcare provider. Some may experience hemorrhoids during pregnancy. This usually occurs in the second, again, third trimester. There are distended veins of the rectum caused by vascular enlargement of the pelvis due to either straining from constipation or descent of the fetal head into the pelvis, or as they're pushing, because a lot of times when women are pushing during labor, they're using their rectal muscles. So much pressure on that, and just also having the head of the baby just putting so much pressure in that rectal area will cause those veins to distend. So usually it may disappear after birth when pressure is relieved, but one of the things that we tend to do, we provide some topical agents to treat hemorrhoids. So we have these witch hazel pads. They're just like these wet, moist pads that they just kind of fold in place in their perineum area. So again, that kind of helps soothe that area, kind of helps alleviate that pain that they may have. Some of them may have rectal suppository, or they may have a preparation H ointment that they may place. But some of them may take a sitz bath and increase fiber to help also with preventing those hemorrhoids. So backache. So some women may experience a lot of backache, and that's results of the spine adaptation to postural changes as the uterus enlarges. So a lot of times they kind of bend backwards, which we call that orlodorsis, which is exaggeration of the lumbar sacral curve, and that can cause a lot of muscle strain. Again, that's why it's important that we educate our patients about healthy weight gain during pregnancy, because just imagine that they're holding this extra, the ideal weight is 25 to 35 pounds if they have a normal weight. So they're carrying all this extra weight right on their pelvis. So, and it's being supported by ligaments. So it's almost like a little hammock that you're holding up this baby. So if women gain more than 25 to 35 pounds, then, you know, you can definitely, women will experience some strain in their back as a result of that. So what we tell patients is, you know, obviously maintain the ideal weight during pregnancy. Maintain correct posture with head up and shoulders back, and use good body mechanics. And so when we all learn about good body mechanics, making sure that we're avoiding exaggerating lumbar curve, squat rather than bending over when picking up an object, bend at the knees, not at the waist. Avoid gaining too much weight, avoid high heels. Not only that, but that can increase risk for falls for pregnant women. Avoid sudden change in position. Sleep on a firm mattress. Encourage rest. Exercise regularly, and a sideline position may be more comfortable to sleep in. And then they can do pelvic tilt exercises as well. So, shortness of breath. So, later in pregnancy caused by uterus rising into abdomen and pressing on the diaphragm. So, as that baby is growing, that stomach, the stomach is growing and growing, and it's moving upwards. So, it's kind of squishing the lungs. So, these women, they can literally walk just down the hall and they're panting and they're out of breath. And that is expected during that time as the baby's growing. Towards the end of the third trimester, as the baby starts to descend, to start to get ready from preparation for birth, normally the moms will start to feel a sense that they can breathe again for that same reason as the belly is dropping. So again, intervention: sleep with extra pillows under head, so kind of elevate the head of the bed. If they're able to, or at least prop with pillows. Use proper posture when sitting or standing. You want to allow frequent rest periods and avoid exertion. And then contact the health provider if if conditions worsen. All right, so we're going to talk about leg cramps. So this is pressure of uterus on the blood vessels and impairs circulation to legs, causing muscle strain and fatigue. It's also caused poor peripheral circulation and occurs as a result of imbalance of calcium-phosphorus balance. So again, this is one of the ways that you can, how to deal with a leg cramp, because as we know that a leg cramp can be very, very painful, and the last thing you want to do is ever move, because as soon as you move, it may hurt more. So one of the things that you want to have the patient do is extend the affected leg. So wherever they're having that leg cramp, extend their leg, keep their knees straight, and all they need to do is dorsiflect the foot upwards towards them, like in the picture. And that really actually helps alleviate that leg cramp. They can place heat over affected muscle or foot massage while leg is extended. And they want to, again, notify the provider if symptoms persist. So common discomforts during pregnancy also can be lower extremity edema. So you'll see women that have really swollen feet and legs during pregnancy. And again, that's by circulatory congestion of lower extremities. So interventions is elevate legs when sitting. You want to have them increase rest periods, avoid constrictive clothing, and prolonged standing and sitting. And they want to exercise to promote venous return as well. Okay, we're going to talk about varicose veins. So it's relaxation of smooth muscles and walls of veins caused by elevated progesterone. So they have pressure of enlarging uterus, causing pressure on veins, resulting in development of varicosity in vulva, rectum, and legs. So as you can look in the picture here, you see that there's the normal vein as it's flowing and as it circulates blood, and then you look on the bottom one, so like it almost kind of damages the valves and it causes that spider like little bluish veins to pop out on your leg. So one of the ways that we can help with that is wear supportive hose, so compression hose. So a lot of us nurses already wear those at work just because when we're standing for 12 hours, you definitely need that support. Elevate the feet when sitting. Avoid long periods of standing or sitting. Change position frequently, so they want to stretch and take small walks. Avoid leg crossing if all possible. Avoid constrictive clothing. Exercise moderately with frequent walks to promote venous return. Wear the support stockings, but avoid tight knee highs. And sleep in a left lateral position, because again, left lateral position promotes tissue perfusion, sleeping on the left side, so that can promote more better circulation as well. Epistaxis, nasal stuffiness, and gingivitis. So again, this occurs with elevated estrogen levels, causing increased vascularity and proliferation of connective tissues. So women may have suddenly have really reddened gums. They may start to bleed. So it's very important, and again, it's hormonal. So one of the things that they want to do is make sure they brush their teeth with a gentle toothbrush, floss, and brush their teeth twice a day at least. They should have a 6-month dental checkup. Just promote good dental hygiene to help avoid that. Some women, again, face suddenly get nasal congestion, and this and it's because their nose begins to swell up a little bit. So with the stuffiness, sometimes they get dryness in their nose, and then that can lead to bleeding. So we want to use a humidifier in the room to help moisten the air, so that prevents that dryness. We can encourage to use normal saline drops or sprays, and that can help again moisten that area that feels stuffiness, and then in turn prevent the bleeding of the nose. Here we have some BraxtonHicks contractions. So again, this kind of occurs in the 2nd and 3rd trimester. They're intermittent, painless uterine contractions. And so basically, they're like your practice contractions. So it's almost like the body's preparing for these contractions to occur. And it does not cause cervical changes it's usually associated with false labor. The mother will experience like some little tightness in front of their belly, and it'll just go away and when they move or start walking. So again, they will subside when they start walking or change position, and it's just feel a little bit of tightness in front of the fundus. But if contractions increase in intensity and frequency and they become more stronger and they're kind of less than 37 weeks, then they probably need to call the provider. Lastly, it's supine hypotension, and this is also called aortocaval compression or vena cava syndrome. So this basically occurs, if you look at the picture, when a woman is lying flat on her back in a supine position. So what happens is that baby is laying right on, just starts to lay right into her, and it actually compresses the inferior vena cava. So what that does is that it reduces the blood return to the heart, and if it affects the blood flow, then that affects the blood supply to the baby, because that's the placenta supplies, goes back and forth with the umbilical cord, providing those nutrients for the baby. And so that heavily affects the baby. So the mom will feel lightheadedness and faintness. Sometimes maybe she may have blue tinged lips. So what the first thing we want to do is turn her to one side to relieve that pressure immediately, because we need to intervene and fix the underlying cause first. Because if we decide to go to vitals first, and she still continues to be on her back, then we have a problem there. So we have to put her on her side first. And so preferably the left side or semi-sitting with knees slightly flexed. So anytime that you have to position a patient on her back, like if she has to go for examination or anything like that, you want to make sure that you put a wedge underneath her right side so that she's not laying flat on the back. Okay, so this concludes our discussion today. So if you have any questions, please feel to email me. Please make sure to do the workshop, and that concludes this lecture.